Marissa Fayer is an accomplished medtech executive, entrepreneur, and philanthropist with over 2 decades of experience in the industry. Her work primarily focuses on advancing health equity for women through various leadership roles and initiatives. Welcome to Keep IT Healthy podcast, the show hosted by people making things happen in technology, aiming to optimize healthcare delivery, health, well-being, and fitness. My name is Jan Kamiński and I'm the co-founder of AppLover, a company dedicated to improving the quality of life with IT solutions and digital advisory. We started making this podcast to amplify great thinking to propel healthcare forward. What were your strategies for navigating and succeeding in the predominantly male-dominated industry? I mean, health tech, medtech, and femtech, obviously.
Unfortunately, I had to work 3 to 5 times harder than any of the men. I had to put in the longer hours. I had to take on the hard assignments. I mean, listen, like I was assigned to go down to Costa Rica to do an evaluation. I came back, handed my senior vice president a new job description and said, I'm moving. I mean, I took on the role to do that. I made sure that I took on the harder assignments. I was always looking, just generally, I'm always looking for more. I'm always looking to do more. You know, it wasn't easy. It's still not easy as a woman in this field. In women's health, one of the reasons why I advocate so loudly for women leaders generally is because we know that the issues that are affecting women. So why would we not lead the companies that are trying to solve those issues? And men need to be beside us. Everything about equality is 50-50. It's not 100% women. That's actually not the solution. But making sure that women are at the table, women are in decision-making positions, women are part of design, that's important because, I mean, we are 51% of the entire global population, so there's no reason that we shouldn't be having those types of positions. You know, I'm not going to sugarcoat it. It has not been incredibly easy. I'm very blessed to have some leaders when I was in corporate to really, help and shepherd me along. And then there's other ones that I had to fight tooth and nail against to make it happen. And I think it's a personality thing. And I don't want anybody to, I guess, have to struggle as much as I did. So I try to make it a little bit easier for everybody following me.
Mm-hmm. That's very interesting. I mean, I hear that in the podcast about, especially when we talk about femtech with femtech founders.
Yeah.
They talk a lot about this. But what would be the advice that you would give to aspiring female entrepreneurs and leaders, and especially in the femtech sector in technology?
Do it. We need more of you. It's not even a question. It's not even I'm not going to sugarcoat it. We need more women. The other thing I want to say is you don't necessarily have to be an entrepreneur. Actually, there's a lot of entrepreneurs out there. We don't need everybody to be an entrepreneur. It's certainly not sexy. It is not easy. You can do everything and make a huge difference in a company as well, in a large corporation. There needs to be women's leaders there. There needs to be people advocating for women in every position and leading and growing in corporations too. So it's not like you have to be an entrepreneur. It's not like a moral imperative for everybody to want to be an entrepreneur. It is not something I ever aspired to. It's not something I ever thought about. I literally fell into it. And it's not easy. It's not the easy road. So I'm just saying for female leaders, you don't necessarily have to be an entrepreneur if that's not what you want and that's not what is interesting to you. There's so many ways to go about it. So, I mean, the question, my answer still remains the same. Just do it. We need every single woman as part of this industry and as part of moving all of us forward.
I know you're involved in a few organizations, like one, obviously, DeepLook Medical. You're the CEO of HERhealthEQ. That's focusing on providing medical equipment to create health equity for women globally. And you're also a partner at the investment, VC, as I understand. So how do you divide your day? How do you find time for all of that?
I mean, most of my time, obviously, as a CEO of DeepLook Medical is spent on that. HERhealthEQ is a global nonprofit. So that's a lot of my passion and my heart work. And I found that about 7 years ago. And we've deployed medical equipment in 9 different countries. 40,000 women have already been impacted with better health. And we're just continuing to grow and scale that. Certainly not full time. Maybe when I make my multiple millions and billions, then I will have lots of time to be doing that. And, my work with investment firms, I'm very much advising and helping, and when needed. And it's something that I'm passionate about staying involved with, because investing in women and women's health companies is something that is something that I will continue to do forever and for the rest of my life. And it's important to make sure that women's health companies have investment. They are the right companies for anybody to be investing in. There's a lot of scrutiny, unfortunately, specifically on women's health companies. And so making sure that I can advise and help and say, this is the right, this is the right company. This is where I can help and help them grow, and give them my advice. That's important to me, and something that I always want to be continuing to stay in. But honestly, most of my time's obviously spent on DeepLook Medical. Growing a med device company is certainly not the easiest to do, but it's I'm very lucky that first of all, I'm a woman and I know how to multitask. That's always helpful. Not to shade any of the men, but women are very good at multitasking. And I'm an engineer. Like, my brain sometimes, and I think any engineer out there can understand, like, my brain thinks differently sometimes. And so we're very organized. I'm also a manufacturing engineer, which is very process oriented, which means, like, my calendar is color coded on my phone, which helps me brain shift in order to determine what I'm thinking about at that time. I work a lot of nights. I work a lot of weekends. Especially on HERhealthEQ. These are things that I love to do. So, and then that are important to me. It also makes sure that the medical devices that we're all developing at all these bigger companies actually have a second life in developing countries, and lower middle income countries, where they're not considered waste. They're absolutely necessities. And so, I don't know, it's a lot of time. I don't think my sleep schedule is incredibly healthy. I'm working on it. I preach to everybody that they should take care of their health. I work on it every day myself. So a lot of prioritization.
And what was the pivotal moment in your career that significantly influenced the commitment to health equity for women, to femtech in general?
I don't think there was one. There really wasn't one moment. I was always involved with women in STEM as an engineer, of course. I always, was helping, girls and figuring out, even when I was just out of college, or, I would always help girls' STEM programs in the community and things like that. It really solidified to me when I went to work for a women's health company. It's not something I was seeking out. It was a great company. It was near where I was living, and it was a great opportunity. I found my passion in there, and I found my passion and my love for it. And I mean, I created a global nonprofit out of the work that I discovered when I was there. My passion for women's health continued. I created programs even in a corporation that were the first of their kind, giving back to the communities which we worked in, especially in women's health. Like, I almost created my passion for it, but I had the environment because I was working in a women's health company. And again, I literally fell into it. Like, I didn't seek out a women's health company. I think obviously years and years ago, I'm older than I might look. That that these things weren't popular. I mean, I worked at the largest women's health company before people knew what women's health was. It was not something anybody talked about. So I'm lucky. Like, I literally fell into it. But my passion came out of living abroad, quite honestly, and health equity, and seeing the inequities that are in developing countries versus in the US, the waste that we have in our system. That very much came out of experiences. And I don't think that I would have, if I didn't have that experience, that I would have necessarily taken or had this path, or maybe it would have happened eventually. But I think everything that you experience and that's put in front of you very much influences where you go. And for me as an engineer, and it's funny because I don't necessarily still identify as an engineer, but it's my background. But we solve problems. We're taught to think a different way. We solve problems. I saw a problem. I went about solving it. And, that's how I very much got into the health equity side, with side of the business.
Okay, and like, so when did you found DeepLook Medical, and then and what's the company main business?
So I actually did not found DeepLook Medical. I was brought in as a CEO. So the company was founded in 2018. The two of the founders actually found me. I was speaking at a conference. I was very passionate about women's health, and I was very passionate about some things that were said at a luncheon. And the two founders approached me, and I started as an advisor for 2.5 years with the company to see its growth trajectory. And then in 2022, in August, I was named CEO of the company because we were at a pivotal stage to start to go commercial. The product was a little bit more solidified. It was a pathway to growth. And with my background in women's health, with my background in advocacy, with my background in breast, that was very much important to the founders. But what we do, we're a software technology company focused on imaging and oncology. And we a software that works with all imaging modalities, all software technologies, and we overlay to visualize, segment, and measure masses in existing images. So we do not displace any images that already happen, like mammograms, ultrasounds, CTs. Those still need to happen because that's what we need to do our jobs. And we are the only technology that are able to visualize and show the internal morphology of a potential mass in dense tissue, which means dense breasts, lung, liver, thyroid, and other dense tissue areas. And so it's the first of its kind to be able to specifically see in dense breasts, which affects 45% of all women, regardless of who you are. Unfortunately, it also disproportionately, and this is where it's important to me, it's an equity issue because it disproportionately affects Black women, Asian women, and Jewish women. And so making sure that there is equity and technology able to help all people all around the world, that's obviously something that's highly important to me. And new technology that doesn't, that's not cost prohibitive, that's easy for technicians and radiologists to use, that interfaces directly into their workflow. Like these are things that who we are as a company are also important to me as a person. So I'm grateful that the founders found me, and I became the CEO.
And how do you see your technology evolving in the diagnosis and treatment of diseases like breast, cervical, and uterine cancer? I know you specialize in that.
Yeah, so we see it growing. So we're doing development right now to see, hopefully, we can reduce biopsy rates. We can reduce supplemental imaging. We're very much focused on breast cancer, but very quickly in the next 2 months, actually. And we're cleared across all health areas, but we're optimizing specifically for lung cancer, which is a very large issue. And there's screening finally available on a massive approach. And then liver and thyroid. We're not necessarily getting into cervical cancer because there's typically not masses; those are lesions. But yeah, we're expanding into different health areas. We're also growing into different imaging areas, so CT, MR, ultrasound, and again, because we're cleared for it, we're just optimizing the technology to be able to grow and scale. So it's an exciting time. The development teams
But
are very busy.
yeah, but it's already. It's commercialized, right?
Oh yeah, absolutely. It is commercialized. We are, we're working with our sales partners, which include Barco, which is a $2 billion monitor business, Tempest, an $8 billion AI company. And so we're commercializing now. We are pre-revenue. We're commercializing, but yeah, we're in growth mode. And we're just expanding at this point. We have our second product in development, which we anticipate launching mid to late Q2, which is also going to be the first of its kind, using AI and machine learning. And it's very exciting. It's still very much in the same space, but it's exciting for new products, new development. We're eventually also going to get into precision medicine with some of our partners. So yeah, we're commercial.
I wanted to ask about the initiatives and plans. I don't know how much you can share, but are there any new projects, initiatives that are that you are currently working on or planning to launch in the upcoming months?
Absolutely. So our so obviously first and foremost, commercializing, selling our products, DL Precise. That's the first and foremost. We do that with our partners and we support them as much as we can. And so that's exciting. Another initiatives that I'm personally working on, part of the White House Women's Health Initiative, specifically also working on dense breast legislation. And so advocacy around that to making sure all women have access to technology and tools for imaging of breast cancer. And thirdly, we will be launching our third product, or our second product, which is called Lesion Library. It'll be expansion of our products now, and expansion into other areas. We're also going to be optimizing. So even fourth, we're going to be optimizing into lung, liver, thyroid, so many other areas, prostate, and just making sure that everyone has the tools to be able to visualize oncology or not. I mean, listen, we would love that there is not, that it is not malignant. We hope that we can show that it's also, we know that we can also show that it's benign so that people don't have to go for supplemental imaging. It's a reduction in the healthcare system costs. It's a reduction in anxiety. It's a reduction in time for people to not need to spend going back and forth to tests that might not be necessary. And so, yeah, we are full steam ahead. I speak daily to the development teams, and there's several of them working on this with us, and so it's exciting and expanding our partnerships with our existing partners, and expanding into probably 2 new partners in the next 6 months. So it's busy.
Yeah, it looks like it's busy, but it's probably it's even busier since I know you've been involved in HERhealthEQ that you mentioned at the beginning, and it's a non-profit organization. But
Yep.
as I saw it, I know it's dedicated to raising awareness and improving access to healthcare in general. But could you give us more details? Like, what do you do there?
Yeah, absolutely. So at HealthTech, we deploy medical equipment. So in addition to advocacy and awareness, we actually deploy physical medical equipment to developing countries focused on cancers that affect women, which is breast cancer and cervical cancer, maternal health, and heart disease. So, for example, handheld ultrasounds for maternal health screenings in more remote settings, cervical cancer screening equipment such as colposcopes with our partner LUTech Industries. We have a big screening program. We're in the process of deploying 100 colposcopes in 10 to 15 different countries, which is very exciting. I will be heading to Ghana in May to deploy one of our projects there. We've already deployed in Costa Rica. We're working on projects around the world. And for us, we take 2 approaches. Sometimes it's newer equipment, but oftentimes it is repurposed equipment or, an older generation equipment that would be thrown away, could be new, could be used. And we want to be part of the circular economy. We don't want medical equipment going to waste just because it has a scratch on it or a color change or there's a new model out. A lot of people don't know that when there's new model equipment that is out, our very fancy hospitals in the US and in Europe and the UK, they replace them every few years to keep up the capital spending and to keep up the look and to make sure that everything is brand new. But I can tell you, and it's not a quality issue, I can tell you most people don't care that there's a scratch on their equipment. And especially when you don't
Right.
have the equipment. So, the intent is like we've deployed a mammography machine, we've deployed ultrasounds, we've deployed heart disease monitoring, cervical cancer screening and treatment devices. And so, we're expanding that work and it's exciting. Like that's the work. Like, of course, that's my passion work. I will always do that work. We have an incredible board who helps me, of course. And we have a team. I have a small team behind me that helps us grow. We have great partners as well. A lot of the medical device companies are partners of ours to either financially support or to provide medical equipment. We actually don't put our teams on the ground. So this is something that's particular to us. We partner with local organizations or local clinics who are already trained. They just need the equipment to do their jobs. We also provide training In all of the equipment, we provide service for multiple years because we just don't want to move trash from one country to another. And we actually make sure that there's potentially service available local in the country, so that potentially provides jobs, especially to women. And so making sure that they have technical skills. So those are things that are important to us. And so that's what HealthEQ does. We're growing quite significantly in the next year, and always looking to work with partners.
I saw your TED talk about impactful organizations, and I wanted to ask you about, Health EQ. How do you measure impact of an organization like that in the communities that you serve?
Yeah, so we measure our impact very directly. How many women have been benefited by better health? So have used the technology, have been covered by the technology. That's how we measure it. It's not like a population percentage, it's whatever. We ask all of our partners to report metrics to us of people screened in coverage area for every quarter. That's part of our deal. Every quarter for multiple years, you have to report the metrics to me or to our team. And that's also one of the ways that we can measure if the equipment's being used. Because if they're all of a sudden telling me that they have not used it, or they haven't screened anybody, there's either A, a problem with the equipment, or B, they've eradicated the entire problem. And if that's the case, that's incredibly wonderful. But we're just going to, we'll relocate the equipment to another location that needs it. So very, very directly, women who have been impacted with better health. Like, it's not we've
Right.
covered the whole population of an entire country with equipment. That's not how we measure impact. Women with better health, or women who have physically used the equipment.
And based on your experience, how do you see the concept of health equity differing across various cultures and economies? And the second, my second question would be, what strategies do you believe that are the most effective in addressing the health differences in especially underdeveloped regions?
Yeah, so I don't think there is a difference between developed and underdeveloped regions related to health equity, for the sole reason of women are deprioritized as far as their health. We can see that obviously here in the United States, and we can see that all around the world. But unfortunately, around the world, women have less access to healthcare. They also deprioritize themselves, just like any woman typically does, to take care of their family and to take care of their community. And so making sure that there is equipment in the community, in a local area, that is accessible and is the right equipment. We're not going to be putting a massive MRI system in the middle of a local community in a jungle. It doesn't make sense. That is not the right sized equipment or what's necessary. And so having the right technology, obviously digital health is very much a huge help for those kind of areas. But I think health equity does not change around the world. It is a moral imperative. It is something everybody has to have access to quality equipment, quality healthcare. So I don't think it changes. How it's different is that there's just a little bit more access to quality healthcare in some of the what is considered developed world versus underdeveloped worlds. It's really just about access. There's about infrastructure. Those are the differences. Quite honestly, I think a lot of the countries that we work with are actually far more savvy with telehealth. They've been doing telehealth way before we finally approved it in the US. And there's a lot of lessons actually to be learned from lower middle income countries about providing care at a local level that actually we would all benefit from. So I think it's just a different type of health equity and healthcare.
And you mentioned collaborations and partnerships in the story of Health EQ. And how did you land the first ones? Was it network that helped? Was it just a cold approach? Was it advisory approach in the sense like advisors?
It was networking. It was a lot of networking. It's a lot of my networking. It's a lot of reasons why I talk very loudly about it. People hear it, people are interested, people reach out to me, I reach out to them, they've heard something. It's a lot of networking. Now it's a lot of our board members and advisory board members that are networking, on behalf of us as well. And a lot of it's also just showing the great impact that we've been having. So I think the beginning was that I was bold and worked on a project while I was at a company, and started it from there, and just started networking to people to make the next projects continue to happen. I don't think the first few ones were necessarily as successful as we wanted, because we learned and we grew, just like any company. There's really no difference between a nonprofit and a for-profit company, to be honest. They're both companies. It's just where the profits go to. And so in reality, there's lessons learned. There's different ways of doing things as companies grow. We've learned that at HERhealthEQ as well. We've learned that at DeepLook. We learned that at every company. And so, it was a lot of networking. I mean, that's the benefit of networking. That's the benefit of talking. That's a benefit of being at, the conferences. That's the benefit of, of having a platform or speaking out about things. So, it's a lot of it's about the network and just honestly making the ask. If you don't make the ask, the answer is always a no. If you make the
Right.
ask, it's probably going to be no, but there's a chance that there's a yes.
Yeah, I agree completely. Could you share some examples of the Health EQ collaboration that significantly impacted a particular country or hospital or an institution? Could you share some case studies, real case studies?
HealthTech has partnered with HealthTech Industries, which is a New York-based company, creating colposcopes, digital colposcopes. And we have deployed 10 to Costa Rica. They're in 10 different clinics around the country. They are screening an average, each one is screening an average of a few hundred, per month. And it's being used when it's needed. Colposcopes are not needed every single time. And so, but it's covering an entire, community and all around the country. We're doing the same thing in Ghana, which we're about to deploy. And we've done this in a few other locations. And so, that's kind of the impactful work that we're doing specifically at HERhealthEQ. Yeah, it's exciting to see it. It's exciting to hear, listen, every single woman who has better health as a result of what they do, that's all I need. Like one, I just, because you don't know who that one person is. You don't know who is part of that one person's family. You don't know if there is a girl who can't go to school because she was too busy taking care of her mother. That girl could be finding the cure for cancer so that we don't have to do our job any longer. It's that girl who could be creating, world peace or a Nobel laureate or any of those things. But the whole point of making sure that women have access to healthcare is so that, of course, they're healthy, but it's to make sure that girls go to school. Because when girls go to school, especially in a developing country, they get pregnant at a later stage, they have more economic opportunities, and they have opportunities for jobs to provide for themselves. And that's important to me. And that's actually kind of the back end of why I started. I was always very much in STEM, but I'm not an educator. I'm not building schools. I'm not, providing education. That's not my background. So being in healthcare, I wanted to make sure that girls had access to school. And the reason that they don't is because they're taking care of their family. And that's not fair for a little girl. She needs to go to school. She has just as much aptitude as any of the boys. And actually, before they're told that they're not good in science and math, girls are better in science and math. It is a natural skill. And so making sure that girls have access to education is the most important thing for me, because we don't know. We don't know what they're going to become. These developments are not going to happen, in Europe and the United States. They're going to happen around the world. And those girls just need to go to school.
In regards to, let's say, young professionals as well, because do you have a mentoring program? And if you do, how do you approach mentorships for younger women or younger professionals in the medtech industry?
Yeah, I don't necessarily have one. I do it very informally. I'm happy to do it formally. I love it. It's my version of paying it forward. I want more women in this industry. I want more women in healthcare. I want more women being in leadership in whatever industry. I want more women to, grow in their professional careers. And so for me, helping women develop, it's just something I do. I'm sure that there's actually, I know that there's tons of programs out there. And I'm happy to be part of any one of them, but it's very much, it's whatever obviously my time allows, and finding the right person. At both DeepLook and at HERhealthEQ, we obviously foster, women's development. This company was founded by men. I've brought in a significant amount of women to our company, our board, our advisory board. That's important to me. They knew that. It's a non-starter. Listen, they brought in a woman CEO. They had to know. And same thing in HealthTech. Like, we have interns. Actually, all of them have always been women. All of them have. It's been a launching pad for so many, additional careers or master's degrees or next steps in their career. And I'm happy to do that. I mean, happy to teach them. I'm happy to help and to learn. So for me, it's just part of it's like, as a woman who's done well, it's my job. It is literally my job to help other women do that. I don't think there's nobody in my circle who doesn't feel that way. So I think, like, we are lucky. We're not, as I said in the beginning, like, we haven't arrived. I don't think anybody's quote unquote arrived. Like, there's always something next, but there's always people to learn. And just like me, I have mentors. I have people, I have coaches, I have people I learned from. I don't know it all. The only thing that I can do is help and share what I've learned so far and pay it forward.
And what was the best piece of advice that you had received in your career?
Oh my God.
I know it's a tricky question.
But I think it was just go and do it, figure it out, and know that you can fail. Knowing that you can fail, and that you can keep on, you can pivot, you can change, you can go from there. And I think that's how you have to approach everything. Just figure out a solution, determine if it's the right one, and move forward. And if it's not, you pivot. And it's just with everything in life. I mean, it's very much something I kind of live by.
Stay in touch with us. Subscribe to our podcast, give us a like, comment, or share. If you want to reach out personally, you can find me on LinkedIn and Instagram.